The dangers of taking turmeric. Turmeric, curcumin, same thing. And so there's the dangers of taking turmeric. So turmeric is actually a Chinese herb. It's used in Chinese herbal medicine, but it's also used in Ayurvedic medicine. And now it's widespread, especially here in the US. Many of the holistic practitioners, whether it's functional medicine practitioners, chiropractors especially, and also some other physicians. They're basically, hearing what the patient is saying. The patient is saying, "Hey, I want to stop taking all of these toxic medications. Is there a supplement that can replace or substitute or prevent that help me to prevent me from my pain from getting worse, my arthritis from getting worse? Is there something that I can take?" Right? Even ER doctors, right? I see this all over YouTube. ER doctors, gastroenterologists, they're all recommending turmeric. And so today, yesterday I noticed July the 9th, there was an article by NBC News, and it was an article showing the dangers of turmeric. And so I'm going to go through the article and share with you some of the facts that are missing, because many of the facts from this article are missing, and it's depicting a completely, I would say, incomplete story, and it can give you the wrong impression of turmeric. Turmeric is actually a phenomenal herb. It's used in Chinese medicine for 3,000 years. It's used safely with zero side effects. But how come now it's in mainstream and people are taking in supplements and it's causing liver damage, right? So let's get into it. Let's dive into it. So here's the article, NBC News. As you can see, it was written July the 9th, 2025. And the title is Woman Says NBC News Report Made Her Recognize Liver Damage from Turmeric Pills. I had essentially poisoned my liver. The 57-year-old daily high dose of turmeric pills caused stomach pain, nausea, and fatigue. And so when you read this title, you think, oh man, then turmeric is terrible. I should not be taking turmeric. Turmeric is dangerous and so forth, right? Yes and no. Okay. Obviously, I'm a traditional Chinese medicine, trained in traditional Chinese medicine practitioner. And so I do have my bias, of course, and I'm okay to admit that. I'm going to be transparent and let you know that's where I'm coming from. But at the same time, I am also a trained biochemist. So I'm going to give you, from the perspective of Western medicine as well. I'm going to give you the facts. It doesn't matter which medicine. It's about giving you the facts and so that you can make the best decision for you. Okay. Relying upon news articles like these to really make a informed decision is dangerous, because these news articles, many times, depending on who pays for who advertise and pays their bills, they're going to slant the information to one source, as you will see. Okay. So let's go through, and I've highlighted some of these things I just wanted to go over so you can understand. And you can understand from a Chinese medicine practitioner, a restorative longevity practitioner, and also a practitioner who uses this herb. Our clinic, my team uses this herb for thousands of patients with zero side effects. Okay. So it says, a doctor, this person, Katie, that they interviewed, she found a doctor on Instagram touting its benefit for inflammation and joint pain relief. Yes, and that is very true. There are many chiropractors, acupuncturists, naturopaths, physicians, ER doctors, liver doctors, every type of doctor, and they are promoting on social media that turmeric is a phenomenal anti-inflammatory supplement, herb, pill that can help decrease inflammation. So you don't have to take those harmful NSAIDs or steroids and so forth, right? That is true. This is true. There are a lot of practitioners, both Western medicine and all different types of medicine promoting that. That is very true. And then it says, that the NBC report that she was referring to in May says that there's a growing rate of liver damage from herbal supplements. This is true and not completely true. So I would say false, right? Because the studies that they're talking about, yes, they are seeing a trend and they're seeing a theory It's not proven, okay? They're seeing a trend and they're assuming. There's a lot of assumption here, as I will share with you another article specifically to what they're talking about. They are seeing a correlation. Correlation does not mean cause and effect. Okay. So, for example, if 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 I wear these blue blocker glasses, it's going to prevent the blue rays from hitting my eyeballs, right? This is a cause and an effect, right? If I pick up my phone and I dial it, I'm going to be able to talk to somebody. That's a direct cause and effect, right? If I eat sugar all the time, if I eat an ice cream right now, my blood sugar is going to instantly go up. That is cause and effect, okay? That is not just that's not correlation, that's cause and effect. What they are talking about here with growing rates of liver damage from herbal supplements is a correlation. It is not a cause and effect, and I will prove that to you in a second, in a few minutes. Okay, so let's move on. She recognized her symptoms. She was taking high dose of turmeric pills with 2,250 milligrams, which is about 2.3 grams, right? This actually isn't a very high dose. Okay, it is not a high dose depending on how the turmeric herb is prepared. If it is just shaved off as a powder, yes, this is a very high dose. However, if you cook it, like in traditional Chinese medicine, right, we cook all of our herbs. Just the fact of cooking decreases the toxicity of the herbs. So most likely, so we take even higher dose than this. Okay. And I prescribe to our patients even higher dose with zero damage to the liver. Okay. So how a herb, I'm only talking about Chinese herbs. I'm not talking about all supplements. Okay. But this turmeric, just Chinese herb is commonly used in all different types of supplements. All supplement companies are using this. Okay. They're using it incorrectly. So it is true. You got to be careful because the form of turmeric that they use is dangerous. And this 2,250 milligrams can be very high and dangerous. Okay. So you have to understand. Now, if whoever's giving you the usually, some people will give you turmeric in just one capsule, like the whole capsule contains only turmeric. You have to ask that person, do they know how that turmeric was prepared? If they don't really know how to use turmeric. And now turmeric is also, in supplements like you'll have, it's just thrown in there. Supplements these days are dangerous. Yes. And we prescribe supplements in our clinic. Okay. But they are dangerous. Yes. Why? Because of the way they're made. They are not made like Chinese herbal formulations. Oh, okay. They are made supplements these days in supplement companies. They just grab this research from PubMed. Oh, turmeric is good. Oh, what else is good? Ginger is good. Oh, ashwagandha is good. Why don't we just throw all of these things? Because research says individually these herbs are great. Why don't we just throw all of these ingredients into one pill and it should help the patient, right? First of all, no significant testing is done. Okay. Some testing is done, but not significant. Okay. And so they don't know what's going to happen when they mix all these things together. And that's the beauty of Chinese herbal medicine. Chinese herbal medicine is there is 3,000 years of testing done to how to mix Chinese herbs together and how to mix them in the safest way. And if you've watched my other podcasts, you will hear me say this over and over. In Chinese herbal medicine, we never prescribe turmeric by itself. We never prescribe one single Chinese herb. If you go to an acupuncturist, an herbalist, and they prescribe you one single herb at a time, they don't know how to do Chinese medicine. Okay. Find someone else. Now let's continue on. There's no clear guidelines in the US about how much turmeric is safe to consume. That is true. There is no guidelines. Why? Because the FDA in the US, the FDA classifies herbs as food. And many of the Chinese herbal medicine, they are food. That's why Chinese herbs are safe when it's used correctly in the correct form. Okay. Next, turmeric pills are not approved by the FDA. That is true also, but this is also a misleading statement. This is trying to mislead you to think that everything approved by the FDA is safe. Medications are approved by FDA. How many people does medications kill? You don't see an article about that, do you? Right? But you see this herb, it hasn't killed this lady, but it's caused liver damage. But medicine has been proven to kill people, but you don't see articles every day talking about FDA approved treatments killing people, right? So this is highly, I would say misleading. So again, who pays for this article, right? Now, according to the evaluation by the World Health Organization, an acceptable daily dose is 0 to 3 milligrams per kilogram of body weight. So if a woman weighing 150 pounds, they would be taking 200 milligrams of turmeric daily. I say this is a good measurement, right? This is a good measurement. But again, they don't differentiate. Even the World Health Organization does not differentiate how that turmeric is processed, right? Because if you just look at, and let me give you an example. When you are making a cake and you put flour, and correct me if I'm wrong, okay, because I'm not a baker, but I believe flour fluffs things up, right? When you apply heat to the flour, it fluffs things up. But when you don't have heat, what is the flour? It's just powder, right? But the same ingredient, flour as raw flour and flour heated up, completely different. It is the exact same thing with herbs. How you process the herb, how you administer the herb changes the herb drastically, changes the safetiness of that herb. That is why, let me repeat, in Chinese herbal medicine, like when we give granules, that's not powder. Okay. It's different from powder. Granules are cooked herbs that are extracted. So it's already been processed in the sense of cooked to make it safe. That's why I could take 3,000 milligrams of turmeric and it would not injure my liver at all. Now, I'm not telling you to do that, okay? And let me give you a disclaimer. I am not a medical doctor, okay? This is a disclaimer I have to make for YouTube's purpose. I'm not a medical doctor, so I'm not telling you what to do with your medications. But I am trained in Chinese herbs, so I am legally able to tell you how to use turmeric, okay? So if you're going to use turmeric in a powdered form or in a supplement form that is made by a supplement company that is not a traditional Chinese medicine company, I would follow this dosage, three by the World Health Organization, 0 to 3 milligrams per kilogram of body weight. Okay. So if you weigh 150 pounds, no more than 200 milligrams of turmeric daily. But if you are taking it in a cooked way, after extracted granule cooked way, you can take more of it, but still, you don't take Chinese herbs by themselves. You take them in combination with 20, 30 herbs. Okay. Now, this woman says she went to the hospital, urgent care, and her liver enzymes showed that they were 60 times above the normal limit. Yes, this is true, and yes, it is possible. Again, now let me give you some more information that this news is not giving you. Okay. Now, the form of the form of turmeric that you're taking can affect your liver enzymes. Also, the the source of the turmeric is just as important. This article doesn't tell you where this woman got her supplement. Was that supplement third party tested and pharmaceutical grade? If it wasn't, it probably contains other contaminants. It probably contains other heavy metals, okay? That these doctors, they don't go and research this. They just say, oh, the bottle says turmeric, so it must be turmeric. Well, if your supplement is not third party tested and pharmaceutical grade herbs supplement, you have no idea what's in that capsule, right? And this is the reason why it's important to only take supplements that have been third-party tested. Don't listen to the, oh, we do our own testing. Forget that. Okay. They're selling their supplement. Of course, they could manipulate their testing. You have to only purchase supplements from that have been third-party tested and they are pharmaceutical grade. Okay. If they aren't, stay away from them. They could have other contaminants, especially heavy metals. Heavy metals will damage your liver. It will raise your liver enzymes. So this raising at 60 times, they don't know if it was the supplement turmeric or if it was a contaminant. Okay. So the source of the herb is important. And then also the form, okay, of the herb is important. So is it cooked? Is it raw? Is it, all those important. You need to have all of those information before you can really say and make a statement to say turmeric is damaging people's liver. Okay. And one last thing about this. Some patients, their bodies are super sensitive to anything, even food, right? They're sensitive to medication and to supplements. I suspect this lady is probably super sensitive to medications also. You probably have a friend or heard someone that says, oh, I can never take the full dose medications. I always have to take only 1/10 or 1/2 of the dose, right? That's just because their liver is super sensitive. We just because we all have a liver doesn't mean our livers function the same way. So that's another component. That's genetics. That's another component that this article did not address. Okay. So you see how it can be very misleading. Your liver, you could probably have taken what she took and have zero problems. Okay. Now, let's see. Then let's move on. Katie Ashley was one step before full liver damage, liver failure requiring liver transplant. This was a hepatologist at NYU, right? This is so misleading. Okay. Yes, her enzymes were 60 times. I've treated patients, liver enzymes 60 times above the limit and got it back to normal, right? Using zero medication, using herbs, okay? Chinese herbs, right? So this is so misleading. This is like misleading people to think, oh, that turmeric can cause you to have full liver damage and it will require you a liver transplant, right? Super misleading. Again, they didn't look at all of the facts. This lady, her liver could have been super sensitive to any supplement, not just turmeric, right? And for this lady, yes, she was probably one step full liver damage. I'm not saying this lady is lying. I'm not saying this lady is wrong. Whatever she says is absolutely 100% correct for her, but it doesn't necessarily apply to everybody else because everybody's liver is different. And this physician says her liver was able to regenerate. Yes, the liver is one of the most resilient organs in our body. It can regenerate. Okay, and then they were saying, oh, there's an increase in liver injuries caused by supplements, though they are still rare. Okay, this article is trying to make supplements look like the supplements are worse than medications. They're not. Okay, they're trying to downplay the harm and the harm and damage of medications by saying supplements are worse. No, they're not. Even here, they say they are still rare. One of the most common herbal ingredients that have been linked to toxic hepatitis in the US. They're saying turmeric is, right? According to a study published in JAMA. And I'm going to show you a study that they're talking about. Last, from 1995 to 2020, supplement-related liver failure requiring transplant increased eightfold in the U.S., according to a study in the journal Liver Transplantation. This was a review in the journal Hepatology. They found that 20% of liver toxicity cases are tied to herbal and dietary supplements. These two statements are so misleading. Okay, and let me address the first one. And I'm going to show you the article that they're talking about right here. Okay, the so-called research, the study that transplant increased eightfold in the U.S. Okay, supplement related. They're saying they know for sure the way they wrote this line. They're saying supplements caused an increase in eightfold of liver transplants. When I show you the article, it says completely different thing. Okay. Um, Next, a review in the journal Hepatology found that 20% of liver toxicity cases are tied to herbal and dietary supplements. Again, super misleading. They do not know directly cause and effect that 20% of liver toxicity are caused by herbs and supplement. This is an assumption. But here's another thing that maybe you might have not paid, you may not have found out. I mean, or maybe not noticed, right? Let's just say they're correct. 20% caused liver toxicity is caused by herbal and dietary supplements. What about the other 80%? They're caused by medication. Why isn't there an article every single day talking about medications causing 80% of the liver toxicities in the US? Why isn't there? Why are we talking about the 20? I'm not saying don't talk about 20%, but why are we focusing so much effort, time, and letters and people's time to write about the 20% causing liver toxicity when we're not even talking about the 80%? Why aren't we talking about why isn't the NBC News talking about every single medication that is causing 80% of the liver toxicity? Why not? Right? So misleading. Natural does not mean safe. That is absolutely correct by this physician, Dr. Marzio. Absolutely correct. Natural does not mean safe. I agree with that. When you cook with turmeric, that could be really safe. Okay, she has a little insight, right, about the preparation, the form. See, she even says here, when you cook it, it's really safe. That's how Chinese herbs are taken. When you cook it, it is safe. But when you take it as a powder, 2,000 milligrams, that is a high dose. That is absolutely correct. Okay. And the end of, before I move on to the article, the liver is a forgiving organ. Absolutely. It is able to regenerate after some damage. Absolutely. And now this lady says, I will never put another supplement in my body again. For her, absolutely, she's correct for her body. But this article was written, it was so misleading. It's telling people, it's trying to encourage people not to take supplements. First, it's encouraging people, don't listen to doctors, physicians, practitioners on social media for medical advice, right? I agree, you should be careful. But these are medical doctors giving the advice on social media, okay? And the second thing is, this article is trying to say don't ever put a supplement. Supplements are still safer than medications. Even if this stat up here, 20% of liver toxicity, if I just base off this stat that they're putting, I'm assuming it's accurate, but it's not. Let's just assume it's accurate. Okay, supplements only cost 20%. 80%. Why isn't there an article having patients saying, I will never put another medication in my body again because it causes 80% of liver toxicity? Okay. So this is what I'm saying. This article is so misleading. Now, let me show you this research that they're talking about up here, 1995, and how the words were manipulated to make you think that supplements are the cause of liver failure. So here's a side-by-side article. Okay, so side-by-side article, you can see, let me just make it bigger. All right. Okay, so you can see it's the same physician that was talking here about this drug-induced, right here. Dr. Dina DiMarzio, right? See, Dr. Dina DiMarzio. So this is the article that her university did, all right? The research, the study, the medical school, the hepatology department. It's challenges in herbal-induced liver injury identification and prevention. Okay, so I'm gonna make this one longer. Just want to show you that it's the same article. I'm not pulling something completely different. Okay, it's the same article. All right, so let's do this. Perfect. So same article, and I highlighted the points that was missed, that was left out in the NBC News article. Okay, so in the abstract, HDS stands for herbal and dietary supplements. Herbal and dietary supplements induced liver injury has increased significantly over the past 3 decades in the drug-induced liver injury network, now accounting for 20% of the cases of drug-induced liver injury. See, that's where they got the 20%. Okay. Now, here's what they left out. There are significant challenges in the identification and prevention of these HILI, which is HDS induced liver injury, okay, due to varying presentations, ability to make clear diagnosis, identification of the responsible ingredient, lack of treatment, and lack of regulatory oversight of the herbal and dietary supplements products to confirm their ingredients and ensure safety. So what does that mean? They are saying there are significant challenges in identifying and the prevention of these due to varying presentations. So they are unclear that these herbal and dietary supplements are the direct cause of liver injury. They are saying this in their article themselves, okay? Then it says the major implicated agents include anabolic steroids. They're including anabolic steroids, okay, which is a medication with herbs. Right? But green tea extract, Garcinia cambogia, kratom, ashwagandha, turmeric, and multi-ingredient nutritional supplements. These you do have to pay attention and watch out. I agree, okay? So here's another thing. The diagnosis of those liver injury remains a challenge. So if the diagnosis remains a challenge, which means they have no idea, how can they say that it's a cause and effect of 20%? They are assuming only, okay? Why? Because they admit due to lack of assessment tools, multi-ingredient supplements, unclear injury patterns, lack of clarity on which ingredients have the potential to cause. Let's see if I can go to the next page. Cause hepatotoxicity, which basically means liver damage, right? So they themselves are unclear. That's what I'm saying. The article was so misleading. And so hopefully, going through this, hopefully you enjoyed listening, having me break down this article and providing the missing pieces of information. Half of the news article was accurate. Half of the information, I wouldn't say it's inaccurate. I would just say they left out 50% of the information, right? So hopefully you got a little more insight. I will be doing another podcast on specifically turmeric, on how to use turmeric safely. Okay, so stay tuned for the podcast on turmeric and how to use it safely. All right. Comment below. Let me know if this was helpful. I can go through these articles and I can help you, decipher what information is correct, what information was left out. I'm not here to convince you. Okay. Turmeric, I agree with the article. Supplements can be dangerous. If you don't, go to somebody who knows what they're doing. Knows what they're doing does not mean they just can regurgitate information from studies. Okay. Like they actually know how to use it safely. Right. So again, I can only share with you, Chinese herbal medicine. Okay. Because that's what I was trained in. That is what I've already used for thousands of patients safely. Right. With zero liver toxicity issues. Okay. And so comment below what other article you want me to comment on. You can attach the article, right? Attach the article and I will do a podcast on that. Make sure you hit the subscribe button and share this with your friends and family so that they can get this crucial information so they are not misled by certain articles and given the wrong information or not the complete information. All right? Peace.